Good morning, guys. I'm going to present on FITT principle today. So, how to prescribe on the physical activity lah. Basically, if an obese guy comes in, and then he wants to do activity like exercise like that. So, what kind of active exercise you want to prescribe lah? So, prior to this, there's 5 A's model of behavior change. So, this is how you assess first the patient. Assess whether he really needs what kind of physical activity. So assess, advice on the health benefits, and you agree with him what kind of physical activity that he can do, and you assist by writing a written prescription. So the prescription is not writing a medication or what, nothing. It's just about exercise lah. So how to prescribe this physical activity is based on this principle FITT-VP. So F stands for frequency. Frequency is like how often. I is intensity, how hard the patient or person can perform. T is for type, and another T is for time lah. So and V is volume. So product of frequency, intensity and time is the product of the volume lah. Progression is depends on the patient, how the patient want to progress lah. So first I'm gonna explain on the types lah. So there's 4 actually: aerobic, resistant, flexibility and balance. So aerobic basically like running, walking, hiking, all that. Resistant is like using weightlifting, and flexibility is like yoga, tai chi, like that. And balance is like you do tai chi or yoga as well as lah. So in this case we let the patient choose lah. So what he enjoys to do, so we let him choose lah. So example, in hiking, right, there's 2 components involved lah. So one is aerobic and another one resistance lah. So because it's mountain, right, so yeah, it's resistant as well lah. So time wise, based on WHO, there's 22 minutes of moderate intensity or 11 minutes of vigorous activity lah, or combination of moderate and vigorous. So that is based on WHO lah. So ACSM says 20 to 60 minutes of continuous aerobic activity, so which means they can do in bouts of 10 minutes. So like small sessions, like 10 minutes of this, 10 minutes of that. So that is what ACSM says lah. So intensity wise, how hard a person can do the work to perform, to do the activity, actually how hard lah. So there is absolute and relative. So absolute is like anyone can do the same activity, like running, anyone can do. So it's like, okay, you give a person to do like 3 kilometers, anyone can do, but depends on how healthy are they, age, healthy, individual factors, all that depends lah. That is what we call as relative lah. It's depends on individual. Okay, so on the health status, age and everything. So how to measure this intensity is by RPE, rate of perceived exertion. The second one is heart rate, and the third one is oxygen consumption lah. So rate of perceived exertion, usually we use box scale. So box scale from 6 to 20, not 1 to 10 lah. So there is another one I read was a category ratio scale lah. That is 1 to 10. The RP box scale is about 6 to 20. So 6 is the light one and the 20 is the maximum exertion lah. So 12 to 14 is the moderate one. Okay, we're still using the box scale actually lah. So for heart rate wise, we use this calculation. Heart rate max equivalent to 220 minus with our age lah, or heart rate, or this is they mentioned that this is more like a traditional way lah, and more accurate way is this 208 minus 0.7 times age. So this is what they said, the latest one lah. So training heart rate to be in range of 50 to 85% of the heart rate max. So when you're training, so you make sure the patient having this range lah, 50 to 85% of the heart rate max lah. So this oxygen consumption, so how much oxygen is being uptake lah. So it's being measured in liter per minute per kilo. So the more intense it is the activity, the more oxygen uptake lah. So ratio of oxygen uptake while activity equivalent to the ratio of oxygen uptake at rest is what we call as metabolic equivalent lah. So 1 MET is equivalent to energy while sitting or resting. So let's say a person is doing exercise, so he considers 3 METs. So means we compare with this energy while sitting lah. Okay. So another one, this is CDC general physical activity lah. So we classify the what kind of activity is considered sedentary, what kind of activities considered as light, moderate and vigorous. So for sedentary, the METs is less than 1.6 METs and the light is 1.6 to 3 METs lah. Moderate 3 to 6 METs and vigorous is more than 6 METs lah. The heart rate maximum wise, the sedentary one is less than 40%. And the light one is 40 to 55% maximum heart rate lah, and the moderate one is 55 to 70, and the vigorous one is 70 to 90. So another thing that we can classify the intensity of activity is using the stock test lah. So if light intensity, the patient can sing. If moderate, converse normally lah. Vigorous means the patient cannot converse, breathing very heavily lah. So the next one I'm going to talk is about the duration lah. So if let's say ACSM say in each session, if the patient burn out about 300 kilocalorie, means he can do about 3 days per week. Or if he can burn about 200 kilocalorie in his exercise session, so he can do the exercise about 4 days per week lah. So the resistance training, they was advising about 2 times per week lah. So the next one is about the volume. So volume is like what I mentioned about the frequency times intensity times time lah. So it is the quality and the quantity of the weekly physical activity. So because we call it as MET minutes lah. So ACSM said we need this 500 to 1000 MET per week. So equivalent to WHO recommendation for at least 150 minutes of the moderate intensity. So the health gain is like about 3000 to 4000 MET per week lah. So how to achieve that actually is by all these activities lah. Stair climbing 10 minutes, walking, cycling for transport about 25 minutes, vacuuming about 15 minutes, gardening about 20 minutes, and running about 20 minutes. So the progression is depends on the patient how he or she wants to progress lah. So basically you usually increase the time first. So 20 minutes, then after 25 minutes, we see if he can tolerate with the 25 minutes or not. Okay, if we tolerate with the 25 minutes, then we taper up the time first before we taper the other principle lah. So the another thing is minimize the sedentary behaviors lah. So like watching TV. While watching TV, maybe you can do a few exercises if you want. Okay, that's all.